Today, we're catching up with Dr. Alex Jahangir on how to band together community resources during times of crisis to protect our nation's most vulnerable populations.
One of the biggest worries then and throughout the pandemic was hospital capacity. And if everyone who got sick went to the hospital emergency department to get a test, obviously we would no longer have the capacity to take care of traumas, heart attacks, and so forth. So again, with these the three health systems I mentioned, as long as with Meharry and Nashville General, we came together in a big conference room. We said, how are we going to get this figured out? And we pulled out this big map of the city of Nashville, and we looked at areas that really were underserved in healthcare. Again, Nashville has some areas that have a lot of providers in healthcare systems and some areas that don't. And predominantly North Nashville, which is a large portion of our African-American community, Southeast Nashville, which is a lot of our immigrant population. By the way, 12% of Nashville is foreign-born, so this is not an insignificant group of our population, as well as right in the center of town, right off the interstate at Nissan Stadium. We decided that we need to really focus testing there. And so we brought the healthcare leaders who've been working again independently to set testings in their own facilities and using their expertise and process engineers. And I have to say that the final piece of the equation that worked, so we had staffing, we had a plan, and we had Office of Emergency Management that provided the facilities, was that we were able to have a great partnership with the state of Tennessee and the state health department, who provided actually the funding for each test. So they allowed us to work with private lab companies and to get the test run, which is not a cheap task. And that was very amazing. And again, partners such as the Nissan Stadium, where the Tennessee Titans plays, they gave us that facility for months to be able to run these testing centers. So it really was a big private-public partnership with both the city and the state being the public side. So Meharry Medical College is a historically Black college university here in Nashville. And it is led by Dr. James Hildreth, who is probably one of the most world-renowned infectious disease doctors anywhere. And we have him right in our backyard. And Meharry Medical College provided staff and continues to this day. We're 120, 130 weeks in to provide staff at our city testing site, one of which is still open. And by the way, that became a vaccination site. And I think the key here is Meharry Medical College and Dr. Hildreth allowed us to have credibility and expertise so that those who are most at risk receive the vaccine. And what is really neat, I'm really proud of, in June of 21, so vaccination efforts really started in January and February. By June 21, so 3-4 months in, those 55 years and older who were most vulnerable of all the bad complications, 53% of our African-American population over that age were vaccinated, and 58% of our white population over that age were vaccinated. So these efforts, by very deliberate communications, placing testing vaccination centers in these communities, and having a trusted partner in Meharry Medical College to deliver the message and the vaccines, I think it led us to have that successful response. Trust is the foundation of what made it successful, and these leaders had trust in the process, and they fundamentally believed that the people of Middle Tennessee need to be taken care of.